Okay, let's talk about the funkiness of a CBC, complete blood count. There's a lot of stuff that you can learn about yourself in a complete blood count that doctors don't always pay attention to. Hi, I'm Dr. Joyce Knief. I'm a naturopathic doctor. I look at labs really closely because I want to learn the most information I can from a lab that's been done. So I'm only going to cover the red blood cell portion of a complete blood count here, but you can learn a lot from the white blood cell portion as well. So those funky little lab markers like an MCV, MCV stands for mean corpuscular volume. You'll also see MCH as well, mean corpuscular hemoglobin, and then there's an MCHC, which is mean corpuscular hemoglobin concentration, and then there's a RDW as well, which stands for red blood cell distribution width. The MCV that you're talking about here is how big your red blood cells are. So having a really high MCV means that you have big red blood cells, versus if you have a really small MCV, that's really little red blood cells. So on a very general level here, if you have really big red blood cells, what this means is that when your bone marrow is trying to pump out your red blood cells, it cannot do as many as it would like, so it starts making bigger cells. This usually indicates some sort of B12 or folate deficiency, because one thing that you require to be able to make these red blood cells is adequate methylation. And B12 and folate are really important for methylation. And now if you have really small red blood cells, you can think of this as your body is trying to get enough of red blood cells out there that are functional and have enough of stuff in them. This is usually associated with iron deficiency. So iron deficiency anemia, you have lower MCV. B12 deficiency anemia, you have higher MCV. And you might not develop anemia just by having a higher or lower MCV, but that puts you on the path to anemia if that's about to happen. And that brings me to RDW, red blood cell distribution width as well. So if you have, your goal of an RDW is to have as small amount of an RDW as possible. Usually like normal sits around 12 or so, like 12, 13, those are generally fine. But if your red blood cell distribution width is like 17 or something like that, this means you have big, small red blood cells. Like the distribution width is very erratic. If you have red blood cells within the normal range, you have slightly big or slightly small, so MCV is slightly high or low, and your red blood cell distribution width is like higher, is like 15 or something. This means you're flirting with anemia. You're not quite there yet, but you gotta supplement with whichever direction your MCV is going. MCH, on the other hand, mean corpuscular hemoglobin, means like we're looking at how much hemoglobin your cells have. So if you have a really big cell, you might still have enough hemoglobin in it. It could look really pale. So if you don't have enough hemoglobin, then you might have a really low MCH, but have a really big cell, MCV. When this is going on, you can check on that MCHC, which is mean hemoglobin concentration. Do you have enough hemoglobin concentration per red blood cell? If you don't, if you have really big pale cells, you might have both vitamin B12 and folate and iron deficiency, and you might need to look at all of those, which is why it's also really helpful if you have a CBC, and you can also check the iron panel, because then you'll know whether or not someone is iron deficient or not. So yeah, if your MCV has been slightly elevated for years, I think the next thing that I would check is a serum vitamin B12 or a methylmalonic acid. If you have other inflammatory issues like Sjogren's, autoimmune stuff, a serum B12 might not be your best bet because that lab can be falsely elevated in some people. A methylmalonic acid would probably be the best way to check for whether or not you have enough serum B12 or are your cells utilizing it, or check a plasma homocysteine as well. I know homocysteine can be a little bit annoying because you have to like chill the tube and make sure that the tube stays chilled when the lab is processing it, but it can be really helpful to know what's going on with your body. Yeah. Oh, and here's another thing. So clinical pearl. If you see that a red blood cell count is really high and everything else looks also wonky but low, check sleep apnea, because that can be something that happens. And if the RDW is looking really weird and nothing makes sense, run an electrophoresis, do a blood smear, check for either beta thalassemia or any sort of other red blood cell issue, because that also exists. I've seen beta thalassemia multiple times in my clinical practice, so it's not as rare as people say it is. Hopefully that helps.